Number one, urinary tract infection happens only because of sexual activity. You drink water, you drink a lot of water, UTIs will go on its own.
Yeah.
Is that true, sir?
And the chances of infections are higher because of the limited, the genital area is very, sometimes not very hygienous, and the probably the use of washrooms and it's like more beer, more urine coming out.
Okay.
It can be taken in that way, but because the beer has its own side effects and other harmful effects, drink more water, more urine comes out. So basically, it all runs around the testicular health. How the testis is functioning, how is the blood going to the testis, how the blood is coming out. Phimosis is a condition where the skin on the penis, which is supposed to come back and forth on the glands, will not come back completely.
As we know, it is called as circumcision, right? So now, is that the only treatment that's available for phimosis, or is there any other way it can be managed, sir?
I would not completely say that doctors' fraternity is completely noble and they are godly, because there are bad apples in every basket.
Very
There are
true.
bad apples. I would definitely accept that, but there are very few.
Welcome, Dr. Prem, sir. Welcome to the Midnight Lab podcast. How are you?
I'm good, Suraj. Thank you for having me here. It's a pleasure, and it is an opportunity for me to get in touch with the public for giving a lot of information regarding urology, which you have been asking for, and it's my pleasure. It's my pleasure being here.
Absolutely, sir. So, as you said, we are going to talk about urology, a word basically where there's a lot of filters and flowing. That's basically what we're going to talk about today. Now, before we get into what urology is and everything, sir, one of the common things that's always associated with urology is hydration, right?
Yes.
Now, today in the world, if you go and read interviews or watch interviews or read articles, everything says that you need to drink so much of water, so many liters of water, so many glasses of water. So basically, water is very key and essential for our body. So how does hydration help our body, sir?
See, basically, body, any enzymes or any bodily activity to happen, you must be knowing, it's a general understanding that every body has 70% and above of water, and the rest everything is tissues.
Right.
It might be protein, it might be other content, might be calcium. It's all made up of chemicals only. So water is the main chemical in the body.
Right.
And to have all the activities in the body to undergo, body as a you can't completely fix to a particular volume for every subject or every person, but it's usually 2 to 2.5 liters of water is required for the body to function normally for its basic requirements.
Okay.
If it is a very humid and hot environment where we sweat a lot, or we keep on talking like we are talking right now.
Correct.
The moment we start talking, we exhale air outside. So the exhaled air will also carry a lot of fluid from the lungs and outside.
Even when we talk, basically
Yes,
there's
definitely.
fluid that's flowing out.
Yeah, it's fluid and it's air which is humid.
Okay.
So we can whenever you see you take a mirror, and when you do blow air into the mirror, you see a lot of vapor coming out.
Right.
It's just water coming out of the body. So that's why whenever we are talking for a long duration, we feel very thirsty,
Correct.
because we are losing water at the simultaneously with air in and out happening.
Right.
So whenever there is excessive talking, excessive sweating, or it's like mainly losing of water from the body, your body requirement will increase. So people who are either too much sweating, like they do a lot of gym activity, physical activity, they are in the sun working all whole day, then they'll have a lot of water requirement.
Right.
If I start working in only AC compartment, not sweat at all. Everything is in the car. You go, you sit in the chair and do all your handwork, and you don't sweat at all.
Right.
So then the requirement of water is very less.
But
Relatively,
even then, when you are sitting in so I work in a corporate office, right? So I work for 8-9 hours a day, and pretty much out of those 8-9 hours, most of my time is spent in air conditioning.
Yes,
right?
yes.
I may necessarily not feel that much thirsty as the other people would who are exposed to sun.
Yes.
But even if I don't drink water, that will still cause a lot of issues.
Yes, you have. That's what basic body requirement is around 2 to 2.5 liters. Which even if you don't work at all, you don't spend your water out, you're not sweating at all, you require 2 to 2.5 liters.
Right.
If you're spending your lot of water is out of your body, even passing motion takes water out.
Right.
Passing urine takes water out. takes water out, sweating takes water out.
Okay.
So if that is more, then your requirement automatically increases. That it may increase to 3 liters, to 4 liters, to 5 liters.
Okay.
And your basic requirement is around 2 liters. And whenever there is a excessive loss, you'll need excess to be compensated for that.
Okay.
That's how the hydration is very important.
Understood.
So you don't drink water, whole day you don't drink water, then the body requirement is not fulfilled. Then the enzymes start less functioning. And your activity comes down, you feel very tired, you feel very dull, because the body activities and enzymes and hormones which are supposed to work, which is a medium. The medium is required is water.
Right.
If the medium is not there, then they don't reach the places where they are supposed to reach, and they don't work properly.
Understood.
That's why hydration is important.
So is there something called as overhydration as well?
Overhydration, whenever, like you said, you're in an air-conditioned compartment, you keep on drinking water. Someone told me that you should keep on drinking water, and you keep on drinking 4 liters, 5 liters. It's like you're putting water into a tank which is overflowing, not required. So you are taking a lot of water into it, and you're not spending it out.
Okay.
So your kidney will have a lot of work to do.
You're putting basically the organ into pressure.
See, the lot of water, your blood pressure increases. Your kidney will be pushed in lot of water, and that has to the kidney has to filter everything, make it more concentrated. So to make it concentrated, so that all the minerals have to be managed.
Right.
Sodium, calcium, potassium, all have to be managed. When you are taking excess of water, the blood starts getting diluted.
Okay.
So the sodium, potassium and calcium and all that will have diluted in that. So the functioning will also be affected. So the kidney starts having function. This has to be concentrated now. Take all the water out. So it starts taking more functioning to happen. And that
creates a lot of other issues as well.
So you'll start having more urine production, and you'll start visiting the washroom very frequently, 15 minutes, half an hour. Because your water is excess. So that has to be taken out.
So you're not doing any help to your body if you're basically overhydrating. So you need to make sure whatever is required for your body, that is what you need to consume.
Optimal hydration is the key. 2 to 3 liters is a very good hydration. And when you lose water, your body says you're thirsty, you drink. So when you feel thirsty, you have to drink. And not drinking anything other than water. Like if you drink a cold drink or something else. It's like basically...
Anything, not every liquid is basically does the same thing that water may do to your body.
But even then, when you take a regular rice sambar or idli sambar or anything else which has water, that also contributes to the hydration.
So hydration is not just water. Basically, anything that also has a water component. For example, let's say watermelon. Watermelon has good water content in that.
Yes.
So that is also as good as consuming water.
Vegetables, fruits, nuts also have water. Maybe a little lesser quantity, but definitely they have water.
Understood. Great, sir. So I think we've had a fantastic start now. Now, some things that I want to discuss is basically myths around hydration. In my opinion, I think urine is one thing that we take for granted. Right? Basically, there are a lot of times when you want to take a leak or basically you want to pee, but because of whatever reasons, you may not do it. Whether you're working, you're sitting in a space where you are busy or whatever. Now, this causes a lot of issues in other organs, and we'll get into that a little later. But there are some common myths. Number one is if your urine is darker, right? That means you're dehydrated. Is that true, sir?
Yeah. See, to an extent, it's definitely yes.
Okay.
Because urine is made up of salts and water.
Right.
Salts are basically salts and a content which taken out of the body, the waste products which are taken out of the body.
Right.
So it's simply you take a glass of water and you put a glass of water and you start putting salt into it.
Right.
And when the salt content is excess, over and above the dissolution power of the water, it starts getting settled down in the bottom. Similarly, you put a little bit of ink into the water. You see there is a good amount of water with little ink, doesn't make a difference. But when there is excessive amount of ink and less of water, the color changes. Basically, urine always has a yellow color.
Right.
Urine has a yellow color. It is there's a pigment in the urine which gives a yellow color. When water is excess, the color gets diluted.
Okay.
And that becomes very clean.
It gets more like a little bit of whitish color that comes.
It becomes almost colorless. When the water content comes down, then automatically the pigment which is already in the urine, which is a natural color of urine is yellow, light yellow.
Okay.
That is definitely comes out. When it gets darker, probably yes, some hydration issues are there which can give the color. But there are other reasons also.
Okay.
Particularly, most commonly we have seen is beetroot consumption.
Okay.
The day you eat a beetroot, your color is bound to become a purplish red color.
Okay.
That is for sure.
Okay.
And there are some medications which we give, antibiotics, nitrofurantoin. There are medications which are called pyridium, pyridoxine. Those things, these are the medications which give a color to the urine.
Okay.
Yellowish, orangish color urine will come. So, and other thing is blood. So there are possibilities of blood coming in the urine where any part of the urinary system, starting from the kidney, the urine tract, the tubes, the bladder, and any outlet in the passage, anywhere there is any breach in the continuity of the inner layer can cause blood into the urine, and that gives a little darker color.
So basically within the body, if there's any spillage or any leakage anywhere, that basically comes into the urine. The blood basically comes into the urine. Is that how it? Okay. So that's a worrying concern. Basically, that's a point where we need to understand what's happening. Okay. Now the other myth is basically if I am thirsty, I'm always dehydrated.
Okay.
Is that a myth, sir? Because you could be thirsty for different reasons. Like someone who has diabetes or sugar, right? They are also thirsty. They may drink a lot of water, but is that a myth?
It's a basic body mechanism. Thirst usually comes when there is blood volume is concentrated.
Right.
Like the blood is very concentrated and it needs to be diluted. That is a response which we have got. And whenever there is a high concentration, your BP increases because the blood volume is very high. And that blood pressure increasing will cause a lot of stress, and you will feel a lot of tachycardia and increased blood pressure, increased heart rate and the blood pressure together. And then you start feeling that your mouth is dry and you want to drink water.
So body is basically working excessively, and that's leading to this thirst.
Yeah, you need water to compensate it and make the blood diluted so that your blood pressure is relaxed and these things. So definitely thirsty means your body requires water.
Water. Okay.
And how much water if you're a normal human being without any main problems, or you're not affected by some disease or anything, you definitely have to drink water. If you are affected by, say, the kidneys are not working fine, your renal failure is there, your heart disease is there, then you have to calculate depending on how much you can consume water, so that hydration is taken care.
Right.
Simultaneously, the blood volume which is supposed to be restored is restored.
Okay. The third myth that we've heard is if we drink 3.5 liters of water every day, we may not get kidney stones. Is that true, sir?
To some extent, yes. I would not say no, but that is not the only requirement for not having a stone. Because body stone formation, I was just mentioning about the glass and the salt.
Yeah.
So there's water, and you put salt, keep on putting salt. The salt, you can take it as sodium chloride in the outside, and inside it is sodium, it is ammonium, phosphates, magnesium, calcium. Everything is a salt.
Okay.
So they are all in the urine as a salt content. Now, like what I said, the water content should either decrease or the salt content should increase. That happens, then as salt gets settled down in a bottom of the beaker or a bottle, the minerals which are in the urine, they start get stuck in the wall of the kidneys.
Right. Okay.
So they start getting crystallized.
Basically, they're getting deposited there.
And they crystallize and they stick to the wall of the kidneys. And if it goes for a long duration, maybe a few months or years, your water content is very less. Salt content, I'll talk about the salt content part later.
Okay.
So this salt get deposited on the walls, and layer by layer the deposition increases, and that forms a stone inside the kidney.
Okay. Understood.
And this salt, as I said, the salt formation depends on how much urate your body is producing or the kidney is extracting, how much oxalate your body is extracting, how much calcium the body is extracting, how much sodium is it extracting. So if there is an excess of sodium, what happens is sodium starts getting removed out, and calcium starts getting deposited inside the kidney. So basically all the minerals which I spoke about, they revolve around calcium, uric acid, oxalates, ammoniums and phosphates.
Right.
So oxalates, I think I'll get to it. Oxalates are very important content in tomatoes, in cabbages, in palak. So these are the content, these are oxalate rich food. So when they are consumed in excess without a compensatory increase in the water intake, they start getting crystallized inside the kidney and form stones.
So they basically go and get deposited and that becomes a stone.
Yes.
Okay.
And if it is properly hydrated at that particular moment, so they get diluted and they pass off.
Okay.
If they don't get diluted, they'll stay as a concentrated. They go and attach to a calcium component.
Right.
Oxalate per se cannot form a stone. Oxalate has to combine with a calcium to form a stone. Uric acid per se cannot form a stone. It has to have some calcium content to form a stone.
Okay.
Similarly, phosphates, ammonia, all either calcium, ammonium phosphate has to form. Calcium is one of the content,
Right.
and along with calcium, all these salts get deposited and form a crystal, and that form a stone.
But calcium is the main thing which
Main
forms
thing.
the stone.
Main thing.
Right.
But calcium, there is a myth that taking excess of calcium can cause stone formation. But calcium is required for the body, for the whole body, bone health and strength. We can't avoid calcium completely because calcium is very vital to the body.
Correct.
So we have to avoid the other component of the stone formation, like oxalates and phosphates and ammonium and magnesium and uric acid.
Right.
So that we have to have with the dietary restrictions and like the things.
Understood, sir. Thank you so much for clarifying those. Moving on, sir. One of the most common, or rather one of the urological issues that we hear a lot is basically urinary tract infection. Right? Sir, for viewers, there are people who understand what UTIs are, but there are also young viewers who may, just want to know what UTIs are, and then we'll talk about some of the myths that are surrounding UTIs as well. So, what's UTI? What's an UTI, sir?
UTI is full form is urinary tract infection.
Right.
Urinary tract infection starts basically from the kidney. If the kidney is infected, it's also urinary tract infection. If the kidney tubes are infected, bladder infected, urinary passage is infected. So, and along with that, in males, if the tubes connected to the testis are infected, the testis is infected,
Right.
they are also considered as urinary tract infection.
So, it's not just one place which causes urinary tract infection. It could be multiple.
Multiple.
Right.
The whole place where the urine passes.
The urinary tract system,
Yeah,
basically.
it's like a plumber. It's like the water supply to the water drainage supply to the whole body. So any place from the start of the drainage till the drainage goes out, if there is infection, it's urinary tract infection.
Understood. Okay.
So basically, there are multiple reasons for urinary tract infections.
Right.
So most common urinary tract infection happens when the infection goes into the body from the outside world.
Okay.
And like we were discussing earlier, the urinary tract infections are commoner in females. Relatively commoner in females.
Right.
Why? Because the urinary passage is relatively only 4 centimeters in a female. And the chances of infections are higher because of the limited, the genital area is very, sometimes not very hygienous. And probably the use of washrooms and the sprays or the tissue papers, basically what all hygiene measures, if they're not taken properly, the infection or the bacteria which is surrounding the genital region then can go into the urinary tract very easily in a female.
Okay.
In a male, because of the length of the urethra is quite long, we have 25 centimeters of urethra.
6 times of basically.
Yes, so 4 centimeters in a female, 25 centimeters in a male. The chances of urinary tract infections are much lesser in males.
Okay.
But the issue is, if there is at the tip of the penis, if there is, the skin is infected. The chances of skin getting infected very often.
Right.
Basically, if the skin is not getting retracted properly, the skin continues to cover the glands of the penis on a regular basis, every day, and it's not been retracted daily and cleaned.
Right.
The skin covers and maintains a cavity in between the glands of the penis and the skin.
Basically, it builds up. It builds up bacteria, or it grows bacteria.
It creates a preputial pouch. The pouch in between the glands, penis, and the skin will have an empty space. It's a space where smegma is produced, all the secretions come, and they are not, if they are not clean on a regular basis, they can harbor bacteria. And whenever there is little bit of immunity decrease, these bacteria can enter the urinary passage and cause urinary tract infections.
Understood.
So this is basically the most common urinary tract infection we come across in an outpatient basis. But this can go inside. By urinary tract infections can go into the bladder. From the urethra, it goes to the bladder. Most common symptoms which we come across is very frequently passing urine, getting a burning sensation while passing urine, and inability to control the urine. Whenever the
urge to urinate,
the sensation comes, they have to immediately go. Otherwise, they'll start leaking in the bathroom. These are the acute symptoms. It can happen 1 or 2 days earlier it started, and that's how the people come. And I've seen most of the people will have some blood in the urine also.
Whenever there's a UTI. Okay.
urinary tract infection.
Okay.
They're the common presentations for us. And based on which organ is affected. Like if it is only limited to the bladder,
Right.
we have a very strong inner layer or epithelium of the bladder,
Okay.
which resists the infection to go out into the bloodstream. People will start getting fever only when the infection happens in the blood.
Okay.
That's the general mechanism everywhere. If it is not into the blood, you'll not get fever.
So basically, if the infection is within the genitalia area,
Within the bladder part.
within the bladder part,
So,
right? So if it's there, that's when you'll have the symptoms of uncontrolled urge to
yes.
urinate. But if that flows into your blood, that's when you get into serious symptoms.
Either there must be a breach in the wall of the bladder, or it has to go into the kidney and then reach the kidney part where there's a lot of blood supply, and that blood takes the bacteria into the bloodstream, and then the fever starts.
But that's also a bigger issue. That means there are some other issues which need to be looked at.
Yes.
Understood. So in urinary tract infections, there are some myths which we read, right? Number one, urinary tract infection happens only because of sexual activity. How true is that?
No, urinary tract infection with a sexual activity is one of the reasons.
Major reason, maybe?
Not a major reason, because we come across urinary tract infection very commonly.
Right.
Most of the common reasons we come across is because of the hygiene. Sexual transmission is one of the sexual transmitted disease. Urinary tract infection is a STD,
Right.
basically. So that happens when there is a partner, when the partner is infected, and then the infection can happen.
Right.
Basically, if the usage of a washroom by some other person who has got infected, he or she touches the genitalia, touches the commode, touches the tap, washes their hand and go off. You come, or the uninfected person comes, touch the tap, and that tap, they touch the genitalia, where the undergarments. Basically, there the transmission happens.
So it can be transmitted from one person to another without basically
come in contact with each other.
Yeah, if like you said, if they've touched something with the bacteria, and if you touch the same part, there is a chance that you may also get that infection.
Yes. And wearing very tight undergarments.
Okay.
Undergarments with tight pant or something, and where there is a lot of stuffiness inside the urinary passage, the genital region, and wet undergarments. You sweat a lot, but you don't change the undergarment frequently. That sweat itself will carry a lot of fungus.
Okay.
And that fungus, if it starts growing there, and it is near the genitals, and it start causing infections.
Okay.
People who are diabetic or immunosuppressed by any chance, they are infected, they have viral infection, they have cough, cold, immunity comes down, and they are more prone to get urinary tract infection.
Okay.
Because the body immunity is down, and your genitals are exposed to fungus or bacteria, they get infected.
Right. So it's very important that you need to take care of hygiene, not just of your body, but at the same time, if you're using a washroom, if it's a common washroom mainly, then you have to be very, very careful around it. Okay. Moving on, the second myth that we hear a lot is UTIs are not serious. I mean, you drink water, you drink a lot of water, UTIs will go on its own.
Yeah.
Is that true, sir?
You should ask a person who's got a UTI. They'll know how bad it is.
I've actually been there once. I've had UTI once, sir.
Okay.
Right. So, like you said, the symptoms that you spoke of, uncontrolled urge to urinate, right?
Yes.
But coming back to the question, is it true, sir?
One episode a year or one episode in 2 years doesn't make much of a difference for anyone. But if it happens very frequently, say once in 3 months, I have had patients who come every month, they come with urinary tract infections. Then we start finding out, trying to find out why the infection is happening.
Okay.
There are multiple risk factors. Risk factors, basically, it must be a patient's own body risk factors or external risk factors.
Right.
Body risk factors are if the urinary tract is at risk at some point, like if the kidneys have got stones in them. See, like the stones are basically, you can relate it to a coral in the sea. They are inside the sea. They are in the water, floating all through, and they can start developing infection on the stone part.
Because of the sharp edges or something.
Edges, and they are in the water all through. And there are any one infection which can happen can go, and the infection can go and sit inside the crevices of the stones. And they start multiplying and forming a colony inside.
Okay, just like how something multiplies within a coral in the sea.
Yes, same way. So and this infection keeps on releasing bacteria once in a while, and they come into the urine tract and get into the bladder and cause infections there. Or if the urinary tract is blocked by any chance, like in males, basically, I'll tell you, around above 50 years or 60 years, we see elderly males particularly, they're coming with very frequent infections, urinary tract infections, which manifest as repeated passing urine or burning sensations, difficult to excrete urine out. That happens because above 50 years, the enlargement of the prostate, like prostate is an organ which is just at the exit of the urinary bladder in all males.
Okay.
And that basically is increasing with age because of the normal human body. As the hair grays and the prostate will be becoming bigger and
So
bigger.
it keeps getting bigger
and
as we
bigger.
age.
Not everybody will have a problem with that. Even if the prostate grows and it maintains a proper passage for the urine to go out, nothing will happen.
So essentially, if it grows, it blocks the
passage.
urine passage.
At the exit of it's like a doorway to the bladder. The doorway opens, and if the prostate is not allowing the urine to go out,
Right.
and it's opposing the walls, that means the urine is not going to flow easily. And because of the urine not going to flow easily, urine starts retaining inside the bladder.
And that leads to frequent urination as well.
Frequent urination, and that gets infected.
Okay.
These I'm talking about risk factors. One is stone, if there is a stone inside the kidney or in the bladder itself.
Right.
And if there is urine which is retained in the bladder, it's not getting completely emptied at one go.
Okay.
That is a risk factor for urinary tract infection. It can happen in females also.
Okay.
Then there are multiple reasons. It's a very vast topic to discuss, but basically the bladder has to empty the urine completely
Okay.
without any stones or any blockages happening. If the bladder is not sufficiently strong enough to empty it out and urine starts retaining inside, it causes infection.
Okay.
Either the bladder strength have to be poor for that, or the exit of the bladder or the bladder neck is not opening completely. Either reason, the urine starts staying inside. This is a risk factor for the body. Stones and not completely emptying the bladder.
Okay.
And external factors, another factor is that patient having diabetes, immunity decreased. They are the risk factors for urinary tract infection.
Right.
And external factors, as I said, if a male has a phimosis, you should be knowing about phimosis. Phimosis is a condition where the skin on the penis, which is supposed to come back and forth on the glands, will not come back completely.
The foreskin, basically. Right.
Foreskin. So that is phimosis, and that, as I said, it can harbor a lot of bacteria, and that can cause infections. And in elderly males and elderly female, particularly elderly female, which I want to talk about, is because of the hormonal change in a postmenopausal woman, the urinary tract becomes firmer and drier.
Okay.
The genital region becomes very dry.
Okay.
And they are prone for scratches and infections because of that.
Okay.
Because they are not healthy. It's not a healthy female urinary tract. So that basically they get prone to get urinary tract infections because of the unhealthy, because of hormone deficiency.
Okay.
Unhealthy genital region, and infections can happen. These are the main reasons for UTIs.
Understood, sir. So I think we touched base on UTIs as well, right? So you mentioned about phimosis. Now, one of the treatments that we hear for phimosis is basically removal of the foreskin. As we know, it is called as circumcision, right? So now, is that the only treatment that's available for phimosis, or is there any other way it can be managed, sir?
Phimosis as such means that skin is not coming back.
Right.
If the skin is not coming back, it's a mechanical problem. Mechanical problem has to be sorted out with the mechanical solution only. So it needs a circumcision.
So when should a guy basically, when he's observing that he's not able to retract his foreskin, should they be trying to retract it or forcefully, or should they immediately consult and get a circumcision done?
If they're able to retract when the penis is non-erect position,
Right.
and it comes back, and they are able to clean that on a regular basis every day, nothing to be worried about.
Okay.
If it is not at all coming back, even in a non-erect state, and they are not able to pull it even a little, then they are at a high risk of getting urinary tract infections. Particularly, they can have cracks at the glands, the peripheral skin or foreskin, and the cracks can keep on becoming over and over, and the skin can become tighter and tighter as the day goes on.
Okay.
And ultimately, sometimes the foreskin becomes completely blocked. Yeah, we call it as preficial stenosis, preficial meatal stenosis. That causes complete blockage, and they may come with a complete urine blockage.
Okay.
So that can happen if it is on a long-term, regular basis. It's getting infected.
Sir, so when we are passing, our urine tells us a lot of things, right?
Yes,
Basically,
yes,
our color. Even when we do a full body checkup, the two things they collect is blood and urine,
Yes.
right? So when should one be alarmed when they see something wrong with their urine, or what are the symptoms that they should be looking out for?
If the urine color is yellowish, light yellowish to watery, then nothing to be worried.
Okay.
If the urine is frothy, frothy means we have the people
A lot
come
of
with
foam,
lot of
basically.
foam coming out. When you pass urine, there's a lot of foam coming and you see a lot of froth. That basically means the urine has a lot of protein in them. The protein content can be because of urinary tract infections, can be because the kidneys are not very good to hold the protein back into the body. Like basically, kidney is filtering the blood.
Right.
And from the blood, it has to take some component of the blood and give the blood back something. So it takes all the waste products and gives back the blood what is required for the blood. It gives back the proteins, it gives back sodium, it gives back all the electrolytes.
Right.
And it is a complex mechanism which happens in a what do we call as a nephron, one single filter, and the multiple millions of filters. 1 million filters here, 1 million filters there. So basically 2 million filters in the body that basically track which component of the blood has to be thrown out, which component has to be put it back. Protein are one component which urine doesn't want to throw it out. It has to preserve because we need proteins.
Right.
When the protein starts coming into the urine, when the filters are not very good, then the urine starts having protein and then froth happens.
Okay.
Not always. It's not always pathological. It can be excessive protein intake also. It can be infection in the bladder can cause proteins in the urine also.
Okay.
So these things and frothy and probably color as you see and the stream.
Right.
Basically in the male as well in female also. Males start having have to see the flow pattern.
Right.
How long the urine stream lasts.
Okay.
How much volume they are passing. And is it going in dribbling down or it is in a very staccato pattern? There is flow comes, stops, flow comes, stops, flow comes, stops. So these are all the patterns which we see in urine passage, passing of urine. And basically if there is any abnormality, the basic I'll tell you the flow should be around 30 to 40 seconds, lasting for 30 to 40 seconds for a 200 to 300 ml of volume. And it should go at a sinus curve, like the flow should go up and come down and stop.
Okay.
That should be the usual.
It has to be curvy basically. It shouldn't be straight or it shouldn't go down. Okay.
Yeah, so that this is the basic pattern. If there is any flow difficulty or the speed comes down or you're taking more than a minute to pass urine, that means there is some blockage.
Okay.
So that then it has to be evaluated.
Okay.
So basically I'll go for a blockage part. I'll touch upon the blockages. So blockage can happen as I was mentioning about phimosis.
Right.
Phimosis becomes very tight, the skin becomes too blocked and the urine can get blocked at that point. If apart from that, the meatus of the penis, that's the exact opening of the urinary passage in the penis, that can get blocked.
Basically in males, basically it's the small hole that we have from where the urine flow comes.
Passes out, and that can happen because of repeated urinary tract infection. It can happen because of traumas into at the passage. Or some people will have meatal dryness because of circumcision also.
Okay.
If the circumcision is done and the meatus dries for a long time, the dryness itself will shrink the opening and become small.
Okay.
And the meatal stenosis.
And the urine flow will reduce. Basically.
And it will be like a thin stream coming and taking a long time for it to go out. So this is at the meatus. And blockages can happen starting from the meatus through the urine passage.
Okay.
Through the urine passage, if there is any injury, like you say, basic injuries are like saddle injuries.
What are those, sir? Sorry.
Saddle injuries like when you're riding a bicycle and bicycle will have a central rod there. And when suddenly you jump down and the rod exactly hits at the perineum, exactly in the middle between the two legs, it goes and hits.
Right.
That is where the urine passage is there and it hits the urine passage.
Okay.
It can cause a trauma. It can cause it's like a urine tube is like this.
Right.
And the rod hits like this.
Okay.
And goes out. And there will be an injury here, which may not be very obvious, may or may not have blood in the urine at that point. But because of the injury, it will start becoming swollen. And because of the swelling and inflammation, subsequently the tube starts becoming smaller and smaller and become narrow.
Okay. And will a hit by, let's say, a cricket ball when you're playing, that will also cause the same injury?
Yes. Hit by a cricket ball or something, at that moment, if there is a blood coming in the urine, that is the indication that the inner part is breached.
Okay.
There's a cut in the inner part. That means there is a risk of that getting shrunken when it starts healing.
Understood.
Okay. That's why, and repeated urinary tract infections. That can also cause a lot of scars inside. Scar, when they start healing, they become narrow. And then the passage becomes small and the urine stream comes down.
Okay.
So it is like tip, with the meatus or the passage because of trauma or by infections, and a prostate in case of elderly male above 60 years.
Which basically blocks the pipe
Blocks
that that carries that urine.
This is how the urine flow comes down. And it's not always mechanical. There are dynamic conditions where the urine's flow can go down. Basically, I'll tell you about the normal mechanism of how the urine goes so that you can understand.
Right.
Basically, bladder is a complex autonomic bag, autonomic nervous system bag.
Right.
So it has muscles which doesn't have, which we can't control. Like we can't control our heartbeat, can't control our intestines, we
Right.
can't control our bladder.
Right.
We only feel the sensation, but we can't push the urine.
Correct.
The urine has to be pushed by the bladder muscle, which don't have control on. So basically, it's autonomic nervous system.
Right.
Bladder has a lot of nerves through that detrusor muscle, we call it as. So they have nerves from the detrusor muscle. There are a lot of nerves coming from the exit of the bladder.
Okay.
You imagine this is a room. Room is a bladder.
Mm.
The exit of the door is a exit or the bladder neck,
Right.
which has a prostate there.
Right.
So there are nerves going from the door. There are nerves going from the wall. They all go into the brain.
Right. Understood.
So whenever there is a bladder distension, it happens. The bladder keeps on getting. The urine comes from the kidneys through two small tubes called ureters. They enter into the bladder. The bladder keeps on getting filled up. At 200 ml bladder filling, the bladder senses, okay, there is some resistance, there is some stretch happening. That stretch receptors will start from the wall. Though the wall takes the nerve ending and goes to the brain. It gives you a sensation that bladder is full. You have to empty. Then the hypothalamus and our the cortex and all, we evaluate, okay, there is a place for us to empty the bladder, not there. So just relax.
But that's the point where you can still control it.
You still control. If it keeps on increasing, 200, 300, 400. When the 400 limit starts, then the sensation is much stronger.
Uncontrollable, basically.
We have to empty. Then we start searching for a washroom at that point.
Right.
Meanwhile, what is happening is bladder is getting sensations there, and the brain is already also giving a sensation to the door. It's giving a sensation to the door. That door you have to be locked all the time. Keep locked. Don't open. So that is always a mechanism going on. Whenever the social circumstances are good and you enter the washroom, you must have realized, even when your thought comes that you have to pass and you are entering the washroom, basically it starts opening up.
Correct.
So that's when the signal from the brain starts going to the door. Okay, he's ready to pass urine. Open up. So then the door opens, and at that point there is signal to the bladder also, to the wall, to start contracting.
Okay.
So bladder contracts, this relaxes.
Right.
So bladder relaxes, this contracts. So this is how. When relaxes, urine stores, this is blocked.
Right.
When the bladder wants to empty, it contracts, it relaxes. So the urine goes out.
Understood.
So this is the basic mechanism. Whenever there is abnormality in this nervous circuit, either patient has a brain injury, has meningitis or infection in the brain, or spinal cord injury, or even the injury to the spine, anywhere in the spine, they will have abnormal coordination.
Because there is a breakage in that nerve, right?
In the nerve.
In the nerve.
It's basically electric failure. Circuit is failure.
The wire between the brain and the bladder is either interrupted or cut.
Circuit is not very properly working. At those times, what happens? Even if the bladder is getting filled up, sometimes signals don't go to the brain. So bladder keeps on getting distended. People will not know only.
Right.
We have seen people coming with 2 liters or 2.5 liters of bladder getting filled. They don't even have a sensation.
So how much of a urine can bladder hold, sir?
Maximum I've seen is around 2.5 liters.
2.5 liters.
2.5 liters of bladder without even having pain, without even having sensation. That is because the circuit is not working.
Okay.
If the circuit is not working, they'll get distended. They'll have such a big abdomen full of bladder, full of water in the bladder.
Right.
And they don't have a sensation at all. At that point, that we know that if the person is holding a urine more than 500 to 600 ml and not getting a sensation, has a neurological abnormality. That's how we diagnose whether it is blockage only or if there is any circuit or dynamic issues happening. Right. Similarly, if there is a circuit issues with the door, where it is not able to send the signals to the door to keep closed, it will be open. So the bladder gets filled up without patient realizing. The urine starts dribbling all through. Continuously dribbling happens. That can happen when there is a neurological problem with the exit or the bladder neck.
Okay.
So we can't predict which will cause what.
So it requires a full diagnosis to understand what the issue is.
So there are special tests for us to do. We call it as urodynamic evaluation, where we basically fill the bladder artificially ourselves, monitor how much pressures the bladder is taking, and we put it on our computer screen and we get all the traces. How much water, at what water inside the bladder muscle starts contracting, or when the patient gets a sensation when the bladder getting filled. It's a 1.5 hours of tests where you find out all the dynamics. Bladder getting filled up, patient getting sensations, bladder trying to pass urine, he gets a sensation to pass urine, whether the bladder opens or not, how much it opens, how much pressure the bladder is pushing, and how much flow the urine is going out. These all are evaluated.
That's run through ultrasound machine, if I'm not wrong. Is it?
No, it is a urodynamic test. Urodynamics is a different test.
Okay, it's a different one.
We put a small tube into the bladder.
Right.
Through the urine passage, and that is connected to a pressure transducer, and that is monitored on a computer screen.
Understood.
That's urodynamics. That's a higher end study which we do, and basically ultrasound is a basic test which we always do. And ultrasound we only let us know whether bladder is full or not full, whether the bladder wall is thickened or it is thin, and whether after the urine is completely voided, we do a scan and check whether the bladder is emptied or not.
Right.
That's basic information we get with ultrasound.
Understood. Sir, so you mentioned of the door sometimes not being closed, basically urine flowing out without our control. Now, can I link this to bedwetting as well? Is it the same?
Yes. So you brought up a different topic now.
Right.
So bedwetting, basically it is the same thing. Bedwetting in a small kid, up to the age of 10 to 12 years, we come across on a regular basis.
Okay.
What basically, and most of the times it is the nervous system is not completely set for that particular person. Still it is going on in a process. And usually happens when there is a premature delivery.
Okay.
If the baby is born at 8 months or 7 months, and their nervous system is not fully developed at that point. That doesn't mean that they'll not develop. It will take some extra time than the normal. If the baby is born at 9 months, everything is well set, well ready.
Right.
If 7 months, 8 months, it will take some more time. It will take few years for the nervous system to completely get into a proper circuitry track.
Right. Beyond 37 weeks of pregnancy, that's basically considered as normal, full term.
Full term.
Right.
So in this, the bladder starts getting overactive. Basically, the leak happens because the door is not completely closed when it has to be closed.
Right.
The bladder will be pushing. The door is not fully closed. It becomes a little loose. Urine starts draining out, and then the bedwetting happens.
Okay.
And this is because the cognition, the brain also has to keep thinking whether this is a social good circumstance where I should pass urine or not. That circuit is still being made.
Understood. Okay.
And when we already come to this topic, I'll just brief you about the continence part of it.
Sure.
How the continence works. How it's a baby. You brought about topic of bedwetting, which is usually common in kids.
Right.
Bedwetting can happen also in young adults or in elderly also.
Okay.
There are multiple reasons.
When is it problematic, sir? Until what age it is okay, and until after what age should we consult a doctor if it's not stopping?
Urine leak is completely abnormal. There is no age group. No, anybody having a leak of urine is abnormal.
Okay.
Urine should not leak. Urine leaking, there is abnormality. What abnormality? Like very, very acute reason is urinary tract infection. Little longer duration without an infection is overactive bladder.
Okay.
Overactive bladder is something where the bladder is acting too fast and too quick for a response for some stimuli. It is responding too quickly for some stimuli. Basically, that happens when most commonly we come across in anxious personalities, very anxious personalities. When they are in stress, they have some challenges to face. The brain is acting too much.
Right.
It's working on, and the brain is sending signals to the hand, to the legs, to the intestine, to the heart. Heart beats faster. The intestine moves faster. Similarly, it starts sending signals to the bladder also. Bladder starts working faster.
I can relate to this, sir. When I was a child, we would play hide and seek, right? So during the hide and seek, there was some anxiety that would come up. Basically, if I'll get spotted and all that, and I still remember that sometimes I had this uncontrolled urge to basically take a leak.
Okay.
But coming back to what you're saying, continence, you were talking about
overactive bladder. So overactive bladder, basically the control mechanism. One is overactive bladder where the bladder is too much contracting, and the other reasons are basically I'll tell you continence. What are the types of continence abnormalities?
Right.
One is overactive bladder. One is stress incontinence. Stress incontinence is the stress of bladder or urine inside the bladder is not being properly managed by the outlet or the door. So stress incontinence. So there is a lot of stress which is not able to control to be controlled. So basically the muscle is abnormal. This muscle abnormality can happen in basically supraphysiological levels where there's a delivery of a child by a lady who has a prolonged labor.
Okay.
Long duration, maybe 12 hours, 14 hours, or one day she's in labor pain but baby doesn't come out. What happens is basically the floor of the pelvis, which holds the baby and the bladder and the rectum, it becomes completely laxed because of continuous strain, and it becomes very loose
During the vaginal delivery.
during
basically.
the normal delivery part. So that basically will go on for a long duration. And that muscle has to regain the strength back.
Right.
So because the muscles are not very tight, whenever there is a cough or whenever there is some increased stimulus on the bladder, the muscle is not able to hold urine and urine starts leaking.
Right.
This happens in a female or a prolonged labor things. And in a male, most of the times it is because of surgery. Whenever we do say surgery for a prostate, we put a camera into the urine passage, go inside and take out the prostate from inside. Basically, prostate acts as one door, and below the prostate there is another door. We call it as a external urethral sphincter, which is also holding. This is holding like bladder. There is a prostate. There is a sphincter or the muscle which is holding.
Okay.
So when we do a prostate surgery, we take out the inner sphincter or the prostate part. We take out.
Right.
But the males are very continent because of the sphincters being very active. In very elderly males, maybe say 70s or 80s, the muscle is relatively very weak. So when one control mechanism is gone because of the prostate removal, the other mechanism is not very strong and it is a little loose. Then when the immediately post-surgery, whenever there's a cough or whenever there is a sneeze, this starts getting pushed out. The abdominal pressure increases.
Right.
That is transmitted to the bladder and that pushes the urine out. And there is the control, if it is less, urine starts leaking. That is what we call as stress incontinence. And there is a condition called mixed incontinence as well. Mixed in sense, there is some component of the bladder muscle being active and there's some component of the muscle also, the sphincter also not very continent. That's a mixed incontinence.
Understood. Okay. Sir, so I think you spoke a lot about prostate, right? So we hear things about prostate enlargement. Now, number one, when should someone be concerned about prostate enlargement? And there are basically some surgeries advised for that, right? So when should one be concerned about it?
Yeah. So as you said, there are a lot of people who come to me with an ultrasound report mentioning that there's a prostate enlargement.
Okay.
Grade 1 prostate, grade 2 prostate, grade 3 prostate. It basically means that you are aging. Prostate is enlarging. Like hair gets grayer, the prostate becomes bigger. So it doesn't actually mean anything for us.
Right.
The only thing which is value for us is whether there is an abnormality in the urine flow. Whether the patient is suffering from frequency, urgency, getting up in the night to pass urine, or the flow is not very good, or there is a lot of hesitancy in the passing urine, and stream is not good, and they feel that the bladder is not getting emptied. All these are parameters which we concentrate on.
Right.
If these are not there, it doesn't matter whether the grade 1, grade 2, grade 3. I frankly tell on the faces, enlargement of the prostate is your age-related process. Don't worry about it and go.
Okay.
When there is in ultrasound scan report, there is also a report called post-ward residual urine. That is the usual important thing for us, because prostate is enlarged, patient doesn't have his symptoms, but the bladder started retaining urine. It's not getting completely emptied. What ultrasound they do is they do a scan and ask the patient to pass urine and come back immediately and do a scan to check whether the bladder is completely emptied or not.
Right.
If it is emptied completely, then that is done. So we don't proceed further. If it is not getting emptied, then we evaluate with the flowmetry, uroflowmetry. Uroflowmetry is a test which I mentioned about the stream.
Right.
It's basically the patient passes urine in a machine which is like a commode, where the urine falls.
Okay.
And the stream of the urine will be calculated by the pressure transducers. There are a lot of pressure transducers below the machine,
Right.
which will calculate how much of water is falling on it at what speed,
Okay.
and how much volume is getting filled up.
Okay.
And that will be translated into a graph. So we know how much volume the patient has passed, what pattern of the urine is going, and how much time it is taken, and what is the maximum speed it has gone. So these parameters give us an idea whether the patient is getting affected by a prostate enlargement or not.
Understood.
If that gives a proper sinus curve on the uroflowmetry graph, we don't do anything. We just let the patient go. If there is an abnormality in the flow, then we start treating with medicines called alpha blockers.
Okay.
Like tamsulosin. Most commonly you must have heard about Urimax.
Yes.
It's the most commonly used medicine. But it's a tamsulosin. The content is tamsulosin. There are a lot of other contents. Alpha-zosin, silodosin, terazosin. There are a lot of things. So those alpha blockers, they start relaxing the smooth muscles or the muscles in the prostate to become loose.
Okay.
So it's basically, prostate is like a potato. And potato has imagine potato has lot of fibers in between, muscle fibers. And we give this medicine for the muscle fibers to relax.
Okay.
So that the prostate, the potato or a prostate which is very tough will become soft. And basically it opens up the inner part of the tube and the urine starts going out.
Understood.
Easily.
Okay.
That's how we deal with the prostate.
Okay. And we hear about in other countries, I've heard this may be wrong, I may be wrong about this, but in certain countries, after you pass a certain age, if you have a health insurance, one of the free checkups that is a part of that health insurance is basically prostate check, right? So now my question here is, when should they constantly look at their prostate or consult a doctor to evaluate prostate, maybe on a yearly basis or something?
There are two main things in prostate. One is whether it's blocking your urine passage and causing all the symptoms which you have,
Right.
or there is a concern of a cancer in the prostate.
Within the prostate, okay.
Cancer. So cancer, it's one of the most common malignancies in urology, the urological practice also. So prostate cancers can come in anyone over the age of 50 to 55 years, most commonly. And we evaluate up to 75 years, up to 80 years for us to see whether the prostate cancer is there. And the funny fact is, what we tell our patients and we discuss among ourselves is, a patient reaching 80 years will have 80% chances of having a cancer.
Within prostate?
In the prostate.
Okay.
In the prostate. This is basically a very, the prostate cancer is a very indolent cancer. Indolent cancer is a very, 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 very less of a strength to cause any problems. Cancer can happen in the prostate, but may not cause any abnormality for the lifespan.
Okay.
Like there are conditions where we diagnose a cancer in the prostate in a male aged 80 years.
Okay.
In octogenarian we diagnose a prostate cancer. We don't usually intervene because we know he might stay another 10 years or 20 years of his age, regular age. Prostate cancer would probably do some harm to it only after 15 to 20 years.
Okay. So basically, once it starts, it may take good 15-20 years for it to actually show the effects of cancer. Okay.
And particularly when there's a grade we evaluate in the prostate cancer. The grades, we have a Gleason's grading, which is come to know a grade grouping we're doing. That's too complex for the people to understand. But we basically see how severe or how high grade the prostate cancer is. We do a biopsy, take a needle into the prostate. We put a small needle into the motion passage, go into the prostate, take some species from the prostate and check the possibility of a malignancy or check what grade the malignancy is.
Okay.
So basically that malignancy is evaluated after 50 to 75 years. How do we evaluate? We do a test called serum PSA.
Okay.
It's a blood test, which is basically, it's a prostate specific antigen. Serum prostate specific antigen.
Okay.
So that is present in the prostate. And some parts of the body, adrenal gland and other parts are not adrenal gland, in the fat of the body, contents, there are very less quantity of the PSA. So what happens is the prostate, whenever there is an injury to the prostate, either because of blockage of urinary tract infections or damage by any chance, we do a cut in the prostate while doing a procedure for the prostate, the PSA starts entering into the blood.
Okay.
Prostate specific antigen increases.
Okay.
So then the blood test shows there is an elevation in the PSA.
Okay.
So when we do a test, say for 55 to 70 years on a regular basis, it's a screening test, we do a PSA and we see the PSA is on a higher level.
Right.
We first rule out a possibility of urine infections, possibility of a blockage, and if those two are treated, we do a repeat evaluation of PSA, that blood test. And that blood test, if it comes down, then that is done. So it means that there was a acute insult or injury to the prostate that has raised the prostate specific antigen and it has gone back to normal. If it doesn't go back to normal or it shows an upward trend on a regular basis when you're doing, then there is a suspicion that there is a constant injury to the prostate, which is usually cancer.
Okay.
And then we start evaluating. We get a scan. usually get an MRI scan to check whether the prostate is completely good at architecture. Some part of the prostate is abnormal, and that part, if it is abnormal, we put a needle there, take a tissue, go see under a microscope and diagnose
The
the cancer.
polyps or something, is that what you're referring to, sir? Or when you say
No,
abnormal?
it's like abnormality. It's like a what do you call it as? It's a necrosed potato. A potato is there.
Right.
I'm relating to potato because it's like that. Potato is there. In one part of the potato is necrosed or something is bad with it. Color is changed, the consistency is changed. So with the MRI, we'll come to know, oh, this is not a normal texture.
So you take that out, basically.
You take a needle and take a evaluation of that. If it is seen that there is a cancer in it, we give options depending on what's the age of the patient, how is the general status of the patient, what is the grade of the tumor, and whether it is only limited to the prostate. If it is only limited to the prostate, the best way of treating is take out the whole prostate.
Understood. Okay.
Or burn the prostate with radiotherapy.
Okay.
Particularly
Burn that part specifically?
that particular part, give a what do you call it, stereotactic body radiation. Exactly the radiations or the heat will go exactly at that point and burns and destroys it.
Okay.
Or we go in, take out the whole prostate completely so that the tumor is completely taken out.
Understood.
That's how we deal with this, which is localized.
Okay.
Sometimes we come across prostate tumors which are spread all over the body. Basically, prostate cancer first goes to the bones. It goes to the spine bones, or chest bones, or the ribs and all. So if that is spread already when the patient comes, then we give a treatment called as hormonal treatment. We call it as androgen deprivation therapy. Basically, the main concept or idea of this hormone treatment is the prostate cancer basically is stimulated by the testosterone of the body.
Okay.
The testosterone produced by the testes is a feeder for the prostate cancer.
So the more testosterone, the more chances of prostate cancer?
No, it's not that way related. Whenever there's a prostate cancer,
Okay.
the prostate cancer is stimulated or it has been giving a feed by the testosterone, which is in the testicles.
Okay.
Earlier days, like maybe when I started my practice 20 years ago, the only treatment for prostate cancer was doing a orchiectomy. Orchiectomy is removing both the testicles. Castrate the patient, prostate cancer is treated.
Okay.
We had a problem understanding why there's a cancer in the prostate. Why are they taking the testicles?
Right.
But the reason is the testicles which are producing testosterone are stimulating or giving a constant stimuli for the cancer to grow.
Okay.
So we take out the constant stimulators, the prostate cancer comes down. Now we have got a lot of medications which mimic the testosterone or reduction of the testosterone.
Understood.
Like we have got GnRH, and it's too deep to go.
Technical, basically.
Technically,
right.
it's difficult. So we basically give medications to bring down the testosterone, and simultaneously the PSA value comes down. That means the prostate cancer is taken care of. And anybody, as I was just talking to you, anybody who has a prostate cancer in their family, maybe father, brother, or father's father, or father's brothers, any male member in the family, their family members are usually validated at 45 years of age with a serum PSA test.
Okay.
To basically check, because it runs in males in the family.
So that could be hereditary, basically.
Hereditary, yes.
Okay. Understood. Sir, one last question. Could be a stupid question before I get into something serious. Now, we spoke about stream, right? Now, in male specifically, so you mentioned that the stream has to be in a sinus curve, right? Now, does the distance matter, sir? So let's say you are peeing from a certain point and this, you're able to go far. Does that mean you have a good urinal system? Is there something like that?
I'll tell you. This question has been asked by many.
Right.
But I'm saying you just relate it to a pipe where water is coming out.
Right.
If the pipe is straight, there's no blockage, nothing inside in the front, the water goes quite fast.
Right.
If you put a cloth on the pipe, like basically you have a foreskin.
Right.
Foreskin in the front. The urine is coming with good flow, but it doesn't go far. It flows with a volume, but it flows down.
Okay.
So basically, if you want to check the exact speed or the distance, the skin has to be completely pulled back and then seen for the flow.
Okay.
That's how we have patients come who say the skin is too much. I'm not getting a flow as I had earlier. So because the skin is too much, it's holding the exit.
Right.
The urine falls down, but it's a good volume and good flow.
Right.
Basically.
So far from whatever we have spoken, sir, key things that I pick up, number one is whatever myths we spoke of, hydration is very important. then basically you have to look out for any symptoms. All the things that we spoke of, whether your urine is getting darker, if there's blood or something. Third, if there is any issue, urinary tract infection for that matter, if it is a frequent issue, then you definitely need to consult a doctor, urologist specifically, and make sure that there are no other underlying issues, right? Okay, now moving on from here, I want to talk about how lifestyle impacts all of the things that we just discussed, sir. So one of the things that we see or we hear right now is alcohol basically causes a lot of issues within our organs, right? So alcohol is just one, but you also have the diets, the protein diets, the keto diets. How does this affect our urological health?
Okay, so alcohol basically has a detrimental effect in all the organs.
Yeah.
Liver is the main target for it. And we never recommend alcohol for anything.
Right.
People come and ask me, if I drink beer, does the stone...
That's the myth which I wanted to ask you, clarify. Yeah.
So it's like, if I drink beer, the chance of stone having the stone is less or not? Basically, I say even if you want to drink, if you are interested in preventing stone, just drink water.
Because when we were growing up, right, you would always hear people within us, anybody that has a kidney stone, why do you want to go to a doctor, have some beer, over a period of time that will dissolve and it will come out on its own?
No, beer basically is a diuretic. It acts almost the same effect as a coffee.
Okay.
So you drink more beer. It's like we have a drug called Lysilectone or furosemide, what we call.
Okay.
So they make the production of urine more.
Okay.
They produce more urine.
Understood.
When you consume beer. So there's a lot of urine coming out.
Yes.
Basically, it's like more beer, more urine coming out.
Okay.
It can be taken in that way, but because the beer has its own side effects and other harmful effects, drink more water, more urine comes out.
So the whole point is basically you're trying to produce more urine.
More urine, so that the stone formation is avoided.
Right. Coming back to basically how diets basically impact or how lifestyle impacts our urological health.
Yeah. See, as I said, when I was telling about the maturation cycle or the bladder cycle,
right?
Basically, whenever there is a bladder sensation or like water intake is good, and usually the urine passing frequency is around 3 hours once.
Once in 3 hours.
3 to 4 hours.
That's a normal thing. Okay.
And if you are in as air conditioned room, you get once in 2 hours. If you are in a hot environment, you may get 5 hours, 6 hours. You may not get urine also. But whenever you get a sensation to pass urine, it's always advised not to hold back as much as possible.
Okay.
As I said, 200 ml, there is a sensation. You try holding, the bladder relaxes.
Right.
400 ml sensation, bladder can't relax further. It starts giving lot of pressure. What happens is if the bladder gives a lot of pressure, the pressure to go out is blocked by the exit. It starts going back into the kidney. We call it as a reflux.
Okay.
So this reflux will take this urine into the kidney back.
Just like acid reflux, basically.
Reflux. So what is supposed to come from the kidney and go out of the body, it's trying to come back into the kidney. That inside, that gives a little injury to the kidney.
Because the urine essentially is just the waste that is coming out.
Yeah, so it goes and hits back to the kidney, and then the tubes start becoming bigger and bigger. The kidneys become swollen, and that is when the kidneys start getting damaged.
Okay.
So whenever there is a sensation, as much as possible, not every time, but as much as possible, when the first sensation, maximum the initiation of the second sensation, you have to pass urine.
Understood.
That's basic. And basic lifestyle, water intake has to be as such good. 2 to 3 liters is what I told. Urine sensation, whenever it comes, you have to pass. And any abnormality in the urine passing, either there is burning, there is change in the color, there is frothy urine, there is speed abnormality, or you are not getting sensation at all. Say 5 hours, 6 hours. If you don't feel like passing urine only, there must be some abnormality.
Right.
Either you are too dehydrated, or your bladder is not taking the sensations to pass urine, or there is a blockage which your nervous system is not taking the sensations at all. So those things have to be looked in and have a evaluation done.
Does dietary change also affect our urological health, sir? Let's say protein diet. I think I heard some. I was reading something. It said a lot of protein, like you said earlier, can also damage your kidneys.
Yes. Right? Basically, kidneys' work is to balance the blood parameters.
Right.
To take too much of protein, the kidneys will have a lot of stress to hold back the protein into the blood to prevent it from going out. Diabetics will have abnormality with that. So diabetics, we see that there's a protein start getting lost.
Correct.
Diabetics, basically there is a microangiopathy we call. So microangiopathy causes the damage to the filter part of the kidneys. So basically there is a filter Because of the microangiopathy of diabetes, the filters start becoming wider and wider. So the protein will start leaking to that.
Okay.
We call it as microalbuminuria. We call it as protein leak. So then in any diabetics, we see the urine test, we see there is microalbumin. There is protein coming in the urine. That means the kidney is getting damaged because of the diabetes.
Understood.
Without any infection, without any other abnormality. That's the initial sign for us to see that, okay, kidney is getting damaged by the diabetes. So basically, for a lifestyle, other parameters also have to be taken care of. Diabetes, if you have, diabetes is very, very important. Diabetes is a universal assault.
Right. Every part of the body is affected.
Every part of the body it can affect because it has an impact on all the blood vessels.
Right.
Blood vessels go everywhere. It can affect the heart, it can affect the brain, eyes, kidneys, everywhere. So diabetes control is very important primarily. And hypertension, blood pressure. Blood pressure also, because it deals with blood vessels and blood vessels go everywhere. It can have impact on every organ. So blood pressure and diabetes, that is the reason why these two important things are very well have to be controlled. Diabetes and hypertension.
Understood. So, sorry, go on, sir.
And as you are talking about protein intake as such, excessive protein intake also causes a lot of stress on the kidneys. Excessive salt intake, that causes a lot of stress on the kidneys because basically sodium intake, sodium chloride intake. So sodium intake will increase the blood volume and increase the blood pressure. Kidney is another function. I think most of us don't know kidney is not just a filter. It has lots of other functions. It has the function of controlling your blood pressure also. There is a mechanism called renin-angiotensin mechanism, which will evaluate how much sodium is in the urine, and that sodium in the urine will calculate, the kidney calculates that, okay, so much of sodium is there in the urine. That means the blood has lot of sodium. That means the BP is high. So they start taking out the sodium out of the blood to reduce down the BP.
Okay.
This I think I had to touch upon. And kidneys also have a function of increasing a component called erythropoietin.
Okay.
Which is very important for our blood cells or red blood cells to come out of the bone marrow.
Okay.
So it also helps in mechanism of production of RBCs.
Okay.
So you must have seen patients or people who have decreased kidney functions, they'll have low hemoglobin. That is because of the decreased erythropoietin which is produced by kidneys on a regular basis, which is not happening. So it has impact on the erythropoietin, which is in result for RBCs or hemoglobin, and blood pressure control.
Okay.
And also calcium metabolism. Body's calcium, which is one of the important components, the calcium and vitamin D3, important component for the kidney for the bones to be stronger.
Right.
So vitamin D3 we get it from sun, which also is produced by the kidneys.
Okay.
And that is very important for the bones to be stronger. So it has its function on the bones,
Okay.
hemoglobin, and sodium control, which is for the BP. These are all other ancillary functions of the kidney. It's not just that filter and that's all. Kidney has its own hormonal milieu, and it has its own mechanisms where it can check the sodium, check the calcium in the blood, and then regulate them.
So you mentioned of vitamin D3. So if let's say I have a vitamin deficiency, which is kind of a common thing right now, especially in people who are working in corporates, especially night shifts, because they are not that exposed to sun. Now, if my vitamin deficiency, if I have a vitamin D deficiency, does that mean I could potentially have a kidney issue as well?
No, kidney is not able to compensate for your vitamin deficiency. Okay. That is the only thing. Because the people or renal failure patients will have lesser vitamin D3 in them. Right. Deficiency is more in them. Because the kidney usually compensate for vitamin D3. And we all get vitamin D3 to sunlight. So if you're not exposed to sunlight, as you said, D3 will come down.
Okay.
So you have to keep on taking vitamin D3 supplements.
Understood. Sir, moving on. So I think one of the trends, ones that we probably don't want is there's been a lot of increase in urological issue or urology issues within young adults, right? So one thing that comes to my mind when I say a lot of young adults are seeing kidney stones. Kidney stones has become very common. So when I was growing up, basically I would hear that, my uncles, my grandfathers, they are having this issue. But nowadays, within my circle, I have 2-3 friends who have kidney stones. I think we touched base on kidney stones earlier, why it happens and everything. But there's also a lot of treatments that are suggested, right? Different kinds of treatments. One is the myth that we spoke, the beer treatment. Then there is basically someone who suggests operations. Then there is someone who suggests laser therapy, right? So please help us, which would be the best way to go about it when you're treating kidney stones.
Okay. Kidney stones, usually if they're only in the kidney,
Right.
basically nobody will have any pain or symptoms.
Right.
It's in the kidney, it's sitting in the kidney, doesn't cause any blockage, doesn't cause any infection, it is there. So when do we treat the kidney stones if they are little bigger than 5 millimeters? That's our criteria as we keep it. Less than 5 millimeters inside the kidney need not have a treatment on emergency basis. We just have to monitor so that it doesn't become bigger. Why it doesn't become bigger? 5 millimeters and lesser, when by chance with a flush or something, the kidney from the kidney it comes down to the tube, can get blocked in the tube.
And it can damage the tube as well?
No, it can block the tube.
Block the tube,
It can block the tube and cause an excruciating pain in them. In the
Right.
And then that will be very severe. It's almost akin to a labor pain.
Oh my
Very
God.
severe pain. And only when the tube is blocked by a stone, this severe pain happens.
Okay.
It will be severe twisting kind of pain. If it is only inside the kidney, it is still in a status where it can be managed on an elective basis. Less than 5 millimeters, we usually presume that if it comes down, the possibility of it going out. If it is more than 5 millimeters, then it has to be addressed because the chances of it blocking the tube is more chances are there.
Right.
So how do we, or what are the mechanisms which we treat? One is there's a treatment called ESWL or shock waves lithotripsy we call it. You must have seen vans, big vans running around for kidney stones. We break the stone and all that. It is basically a sound wave producing a machine which focuses exactly on the stone part.
Through sound, it is basically
focused sound.
Right.
So a lot of sound waves are produced which focus at one point, and that point with an X-ray and ultrasound machine, we exactly pinpoint where the stone is, and we put the sound waves there, and it breaks. It hits the stone, like the sound waves will hit, and stone will break. Very small stones, less than 1 centimeter, we usually break with that. The disadvantage is that we break the stone, we don't know how much is broken, how much will come out.
But when you're doing this, does it also damage the nerves or
not
any
the
other
nerves,
parts?
our surrounding areas of the kidney will get damaged. There are chances of bleeding also. Because of the sound waves hitting the kidney part, not just stone, it will hit on the other sides also. It's like somebody, we have a sudden slap somewhere, it's just not the cheek, it will hit here also.
More like a trauma, basically.
It's a trauma. It's a trauma. So that is one way of treatment. And it is a little bigger than that, 1 centimeter or 1.5 centimeters. We have something called as flexible ureteroscopy with a laser.
Okay.
Basically, what we do is we put a camera into the urine passage, go into the bladder, go into the tube where the urine comes down, into the tube and into the kidney.
Okay.
And see the stone with the camera.
Okay.
It's like basically you must have seen an endoscope going into the abdomen. So through the mouth we put a larger tube. Through the urine passage we put a very tiny tube which has a camera.
Okay.
So basically goes inside, see the stone. We put a fiber through the side of this tube, laser fiber, which goes and hits the stone with the laser beam.
Okay.
And that causes the stone to break.
Again, does that also cause any damage to the part?
There are possibilities of damage with everything.
Okay.
Chances are lesser because we are seeing what we are doing.
Okay.
In a flexible ureteroscopy, we call it as retrograde intrarenal surgery, RIRS.
Okay.
So in this, we are actually seeing where we are hitting and where we are touching the stone.
Right.
ESWL doesn't know. It will be a blind procedure where shock is going there. We don't know whether shock is only hitting the stone or the surrounding area. If it is a larger stone, say 2 centimeters, 2.5 centimeters, 3 centimeter stone, a neglected stone for a long time, then in those cases, what we do, we put a small needle from the back into the kidney. Through the needle, we enlarge the needle track and put a camera through that and basically break the stone there and take it out.
Okay.
We call it as PCNL.
Okay.
Percutaneous nephrolithotomy is the term.
Right.
So that is the way we treat the stone. And these are the 3 basic treatment for the kidney stones.
Right.
The myth, there is a myth associated with this also. Whenever there is a backache and a stone, they say backache is there is a stone, you have to treat it. I come across backache with only 3 millimeters or 4 millimeter stone in the kidney.
Okay.
So that is completely unrelated.
So essentially, basically, whenever there is a backache, there's a myth that means you have a kidney stone.
That is not true. So backache can be mainly because of the spinal abnormalities. The disc compression might be there. There might be nerves which are compressed. That causes a backache.
Disc bulge and disc herniation, basically.
Yes.
Okay. Sir, I was reading an article which said our mental health is basically determined by a lot of factors. Nowadays, there are new studies which are coming about, which are talking about gut health, right? But there's also something which I read, which said that urological health also affects our mental health. Like you said, brain, bladder, everything is connected.
Yes.
How true is that, sir?
See, definitely urinary. Whenever I say, if you are able to basically have a proper lifestyle,
Right.
you are able to get up properly with a good night's sleep, awake and very alert, and go to your work, finish every 3 to 4 hours. You are able to pass urine and come out, and have no difficulty in passing urine. Basically, if the lifestyle is good, in sense whatever organs are functioning, they are functioning at their optimal level, then everything is fine. Any abnormality, you start frequently going to the bathroom, you have social problems.
Right.
People start recognizing you that you are not able to hold urine also. You are starting leaking urine. Some people start leaking in the pants in front of people where there's no bathroom and there's a lot of overactivity, they start leaking. It happens with females most commonly, and though it doesn't come out very easily, but I've seen a lot of females who leak urine during a meeting, or they have a lot of sensations. They can't go because their availability to a washroom is much lesser compared to males. They start leaking. So that happens. This is a social problem. This have a mental issues as well. And if you are not able to pass urine and you go to washroom, stand there. People come and go, 30 seconds, 40 seconds, they pass and go, and you stand there for 1 minute or 2 minutes. Urine is not going at all. Or initiation, sometimes it's like initiation only is little delayed.
Right.
Lot of hesitancy. You stand there 15 seconds, 30 seconds, 1 minute, urine is not coming only. And then relax for some time. Then the urine starts flowing out. So these are all because of stress, which has an impact on the urinary system.
Right.
And anything which is urological can have their impact on the mental health as well. So this is definitely a issue.
For males, basically, the fertility is one of the common things, sir. Fertility rates have dropped, is what we hear, right? Now, how much of it is because of some of the urological diseases or the issues that we discussed, sir?
Yeah. So fertility, coming to fertility, we basically say it as fecundity. Fecundity is like amount of pregnancies happening, amount of babies getting delivered.
Right.
So basically, it all runs around the testicular health. How the testes function, how is the blood going to the testes, how the blood is coming out, how much is temperature around the testes maintained or not. So basically, either if there is a hormonal issues happen either because of brain issues or brain tumors, which can cause problems in the pituitary gland, or basically coming back to the testicles.
Which is the gland basically produces those hormones, right?
Pituitary glands, yeah. They are all the stimulus hormones, LHRH. Or luteinizing hormone, follicular stimulating hormone. They are the hormones produced by the pituitary gland.
Right.
That stimulates the testes to produce more testosterone.
Understood.
If there is a problem there, testes will have difficult stimulation or lesser stimulation to produce testosterone. So testosterone, either it is secondarily affected by problems here or primarily testis itself. Testis, if the blood supply is low, either because of childhood trauma or infections in the tubes,
right,
that can have decreased blood supply, testis will shrink down and the sperm count will low. Baby low and fertility comes down.
Understood.
There is a problem with blood flowing back from the testis to the body. Like it's called as varicocele. Varicocele.
Is it the same as varicose? That's a different thing, right?
Varicose veins, it's basically the same thing. Varicose veins, we give a term for the legs.
Right.
Varicose veins. It's basically a organ, like a testis is an organ.
Right.
Blood goes to the testicles.
Right.
It has to come back out of the testicles, giving all the nutrition to the testis and taking all the waste and come out of the testicles. Leg, blood supply goes, gives the nutrition to all the muscles and everywhere and comes back with all the waste products and goes to the blood, to the heart.
Right.
So whenever there is a problem with the backflow of the blood, like backflow has to be one way. It should be going in, coming out properly.
Okay.
If the going out properly is not happening at one way, and it has two-way channel, like it it's going back from the testicles, but it is not completely reaching the heart totally. It will come back again and giving a lot of pressure into the testicles.
It's basically like, let's take you're taking a car on a slope, right? You're going up, but there's not enough force and the car comes down.
And that's
right.
That typically happens, and these blood or the veins which are carrying the waste products from the testicles,
right,
will also have their heat or the temperature. It basically comes back and settle around the testicle and give a congestion to the testis.
Understood.
So a lot of waste products continue to stay around the testicle. Temperature continues to stay on a higher level, and the testis becomes warmer.
Okay.
Testis is placed outside the body of a male,
right,
because it has to have a temperature 2 degrees lesser than the body
temperature.
So it has to be at a 35 degree temperature Celsius. So if the temperature at 35 degrees is not maintained, either because of these veins which carry the blood and abnormal blood and the heat, or you people wearing lot of tight undergarments, tight jeans, continuously giving a lot of warmth around the testicles, that makes the factory not working properly. Basically, the testicular function comes down.
Okay.
So testis has two functions. Mainly one is to produce sperms, and other one is to produce hormones. That is testosterone.
Okay.
Testosterone also affect on the fertility part in the way that they contribute for the erections and contribute for the sexual activities and for the conceptions and all that.
Right.
So that part is there. Sperms, if the sperm quantity comes down, quantity and the quality comes down, fertility or conception will be abnormal. So varicocele basically is that part, and basically, as I said, it all revolves around the testicular health, warmth, radiations. Like warmth, I said, tight undergarments, tight pants, and tight jeans, and varicose veins which are on that. And if there is a radiations constantly acting on the testicles, basically it's a new generation problem where we have Wi-Fi everywhere, we have phones everywhere. We carry phones in our pant pockets, and they have a lot of radiations coming in, and they they rise the temperature around the phone. Phones always have a rise temperature around that, and we keep it in the pocket, which is very close to the testicle.
Right.
And that increases the temperature on the testicles, and that basically brings down the sperm count and quality. So that is how fertility is affected.
We had our third podcast around digital addiction, where our speaker was Srihari Prahlad sir. He is basically a founder of a company called Sprayan, which aims to create this digital harmony. Exactly, this is one of the things which you mentioned. EMRs or radiations are causing. They are basically affecting fertility, and a lot of papers, a lot of studies are coming out regarding this. Yeah, that's basically what I remembered when you said this. Sir, moving on, I think we've covered some great topics, sir. I'm absolutely amazed by how our body works in certain aspects, because I was never aware of these information. Now, moving on to you being a doctor, sir. So you've been practicing for 20-25 years, like you said, right? Times have changed. Apparently, or unfortunately, we are at a time where doctors are being looked at very differently in some ways. There were some incidents that happened recently regarding a doctor being abused because his mother was suffering from cancer, and her son went and stabbed the doctor 8 times. Generally, when you're meeting patients, do you feel safe with all of this that's going around?
It's all multifactorial, I would say.
Yeah.
Because we have been seeing patients day in and day out, and basically it is a frustration built up by the patients themselves, either because of their own problems. They're very frustrated, and I should not blame this, but it's a problem with the millennials as such, I'll tell you, because everything is very instant nowadays.
Right.
And medical issues are not instantaneously treatable. They take time. And sometimes there are circumstances where treatment cannot be done. Not completely curable diseases.
Right.
And people who don't understand this, they start getting frustrated, and they feel that the doctor is not treating properly. Or I would even say that the patient may think that doctor is expecting more money for us to be treated well.
Right.
That is not the case. I would definitely say. I would not completely say that doctors' fraternity is completely noble and they are godly, because there are bad apples in every basket.
Very
bad
true.
apples. I would definitely accept that, but they are very few. They are very minimal. And out of the circle which I've got, I've had very, very minimal circumstances where I feel, okay, this is not the right way a doctor has to be treated, or doctor should be treating a patient.
Right.
Most of the doctors are for the welfare of the patient.
Right.
Maybe some doctors might be in anticipation of earning more money, but never to harm a patient.
Right.
That is what I would understand. But that's what. So social media plays a very important role. Social media bringing up that the doctor is doing something only for money without the patient benefit, that is not right. I would outrightly say it is not right. They would probably, I would say, money is one of the driving factors for a doctor to work, but not always true. Money may be more in like I practice in a corporate setup. I work, I do charity work also. I go to places where there is no money, and I go to places where very minimal nominal money is, where I go operate also, and without much money expectation. So some surgery which are done for lakhs together, we have done only few thousands, 2,000, 3,000 rupees. I've done operated also. That is a different aspect.
Right.
But it can't fulfill our expectations or fulfill our family's needs and all that.
Correct.
So every doctor needs money. It's not that we can't be completely saint to do practice and do surgeries and not getting anything for us. So expectation is there.
Right.
That doesn't mean that we do malpractice or do unnecessary treatment all the time. As I said, bad apples, one or the other will be there. We can't help in that.
Right. So whatever you said, sir. So I think I was telling you earlier about my career, right? I started my career at 21. For a doctor, probably they are still learning at that time. And then basically nowadays with the way specialties have evolved, with the way technology is evolved, right? Even till 28, 30, they're still studying, they're doing the residency, and then that's basically when they start their actual practice. For me, 30 was like I was settling in my life to some extent. But yeah, I definitely understand this. A lot of respect needs to go to the doctors. Like you said, there may be bad apples in every sector, everywhere. So definitely, yes, sir. Moving on, sir, there's been a lot of technology advancement in the last few years. And with AI coming in, right, in your practice, especially from a urology standpoint, what are some of the major changes that have happened which can revolutionize things completely?
See, the most happening thing in urology practice, because we are surgeons, we operate. Most fascinating thing what we have got is robots. The robotics are in thing now. In every specialty, any surgical specialty, we have robots.
Right.
Robots basically take out all the minor and very minuscule and very delicate surgeries to be more precise. It's not that we can't operate very precisely.
Right.
Because we all have human tendencies to make errors. And robots are machines which work as they are directed to work. So basically, in a robot, another thing I want to clarify is they don't operate on themselves.
Right.
Robots are always operated by us. So we direct the robots what to do, and the robots do it. And it's a ongoing process. It is a continuous stream.
Evolution,
it's not like
basically.
I feed something and the robot operates. It doesn't happen. Basically, to give a proper clarity about it, you must have seen Avatar movie.
Yes.
In Avatar movie, there is a scene where he's sitting inside a robot and he punches and the robot punches.
Right.
It is similar to that. When we operate, it's like the most common and most basic robot is Da Vinci robot.
Okay.
Da Vinci company robot. We operate on that. We sit in a console. We sit in a computer console, and we have been given some instruments to handle with our hands. And that instruments, they are connected to the instruments which we place inside the patient.
Okay.
So basically, when we cut like this, the instrument cuts like that.
So it's basically you're doing it here, and the robot mimics exactly that.
Exactly the way. But here there are chances of us having tremors. But the robot will not have a tremor.
But if you have a tremor, robot would not mimic that?
Will not mimic that.
Yeah.
Because it mimics the basic movements.
Right.
And that is the advantage what we have got. And basically, if we start putting AI into this robot, the robot can assess how hard the tissue is, how soft the tissue is.
Okay.
So that here it's like when we operate, the robot is operating and we are doing it. I can't feel the thickness, hardness, anything. So now AI is coming in with a lot of pressure sensors inside the robot. So the robot can feel the pressures. So it says it is harder, it is softer, and it gives a feedback for us, and we get in the screen. Okay, this is hard, this is hard, this is soft. So I have to cut it a little harder.
Right.
So those things are coming in now.
Okay.
So robot is good thing, and basically very intricate surgeries, very complex, minute surgeries, robot will help because that takes away the tremors.
Right.
And the social thing, which we don't have to push or pull or bend or do something. Robot is already there. We just have to cut we operate like this.
Understood.
So that is the major breakthrough which has happened, and it is almost a decade now, and it is advancing. Yeah. Definitely, there are a lot of robots coming in. Initially, it was from the Da Vinci company, and there are a lot of robots coming in India, manufacturing in India, and going forward, within 5 years or so, a robot will be there in almost all the major hospitals everywhere in India.
Okay. But hopefully they may not replace the actual surgeons.
Definitely no. It can't. They can't.
Right, sir. Last question for you, sir. Again, fortunately or unfortunately, there are two aspects to look at this. Treatment in India compared to other developing countries is way less, the cost of it basically. But probably to study medicine, someone who wants to pursue medicine, right? For them, the cost of learning medicine and basically the number of colleges, everything that we have, or the infrastructure or the ecosystem that we have, may not be as sound as it is probably needed, right? Basically, if someone wants to learn medicine, what's your piece of advice to them, sir?
I would leave it to their wisdom, basically. But I would say I am being in the medical field from past. I finished my graduation in 2001.
Right.
It's been 24 years since I finished my graduation. So within 24 years, I've still realized that it's definitely a noble profession. I don't regret coming to medicine because it's a respectable job, and it is like you are making a difference in someone's family,
Absolutely.
someone's body, someone's family, and definitely this is a work which can bring smiles on the patient's faces.
Right.
That gives a lot of relief for us.
Right.
And definitely, I would say money is a factor which we can't reach money which a businessman makes or some politician makes. But definitely, we have a decent amount of money which for us to live a very healthy and sustainable life.
Right.
And I would, if there is a person who wants to pursue medicine, I would definitely welcome. It's a welcome profession.
Right, but like I said earlier, sir, it requires a lot of dedication compared to probably other fields that we go into.
Like
in this field.
You were saying that you are 21 and you are ready to earn money. I started earning money only when I was 30.
Right. There's one more basically there's one more thing which we would hear in our office, right? Whenever someone made mistake, we would tell them, see, you have to make sure that you're doing everything right. Imagine a doctor saying this, that I did 99 surgeries right, one surgery was wrong, right? So that was one analogy which we would give to our juniors, right? That making sure that when you're doing something right, you need to make it right. That's basically what I'm trying to get at. For a doctor, it has to be 100% whenever they're treating someone. Great. Prem sir, like I said earlier, fascinating topics. Some of the things that I had never heard, I basically got to know from you, and the way you explained it, at least helped me a lot in learning how how our body works in many ways, right? And I hope that our audience picks that up and hopefully they get some valuable information, which I'm sure they will. So a big thank you to you for making this happen.
That's the purpose of the talk.
Yes, thank you so much, Prem sir.
Welcome.
Hopefully this will not be our last conversation.
Yeah, it will continue. Definitely continue. It's my pleasure for being here, and this is basically information sharing.
Yes.
And I'm very happy that I could share all these informations to you and to the general audience as a whole.
Great. Thank you so much, sir.
Thank you.